you want to keep the gluteus maximus relaxed. You want to keep the hips relaxed. And you absolutely 100% want to continue breathing through all of these exercises. Doing a breath holding maneuver, a Valsalva maneuver, is going to be detrimental, not beneficial. So try to keep everything relaxed. I want you to take your index fingers or your first two fingers and find your ASIS on either side. Sorry. Now I want you to slide those fingers down and in just slightly so you're on muscle instead of just directly on bone. And I want you to visualize the muscle running between those fingers, that you've got a belt of muscle there. Okay. Now I want you to gently lift up and in like you were trying to stop the flow of urine or slow the flow of urine. There's no pelvic movement here. We shouldn't see really any big movement. You may feel just a little swelling of the muscles underneath your fingers, but there should be no straining, there should be no breath holding, there should be no pelvic movement. It is very, very small. And once you start palpating and getting the feel for it, you can feel the muscles swell up underneath your fingers, the transverse abdominis, and you may have to coach patients to do that as well by putting their fingers where they're supposed to be, putting yours over top of them or right next to them, and just say, all right, I really just want you to focus in on this right here. There shouldn't be any movement. It's super, super small. I had the pleasure of working in an outpatient clinic that had an ultrasound machine, and we would actually use the sound head externally. We would find the transverse abdominis muscle, we could measure the thickness, and we could instruct patients in Kegels and pelvic floor exercises and see the transverse abdominis contract. We could also see the internal and external oblique muscles over top, and we could see the bladder. And if the transverse abdominis contracts correctly, the bladder should lift a little bit and kind of squash down. If you're engaging too many of your global muscles, so your rest of your trunk muscles, you would see the obliques thicken instead of the transverse abdominis going first. We have to downtrain the body so the bigger, stronger muscles don't contract first. We have to get them to relax, engage the deeper core muscles, the transverse abdominis, pelvic floor muscles first, then the others can kick in. But if big muscles kick in first, you're not going to get the smaller ones to be able to fight to get their position in the race. They're going to lose every time. So just doing a pulling in or just trying to tighten and suck in your belly is going to be too much. We have to get the pelvic floor, the Kegels first. So once someone can get this contraction down and still breathe and perhaps hold it for 10, 15, 20 seconds, then we can add some movement. But not until someone can actually control it should we add any movement. So if we start with the Kegel first, we can add a little bit of lower extremity movement. So just barely sliding one foot forward and back, sliding the other foot just slightly forward, not even all the way straight, and definitely not holding it off of the table. You're just sliding along the table. I will take shoes off of the patient so there's less friction. So they're just sliding their foot, maybe even put a plastic bag under there to make it even less friction, or a washcloth on a vinyl surface like this to make it as little friction as possible. All the while the patient has to hold the Kegel. So you may have to say, all right, pelvic floor on, slide one out 6 inches, slide it back, relax the pelvic floor. Recontract, do the other side, out and back, relax the pelvic floor until they can get good 10 repetitions and not lose the Kegel by the time they start pulling the leg back, because as soon as your leg gets farther away from you, guess what? Those hip muscles start engaging and they start pulling on your pelvis. Okay, so then you can work up to engage. So Kegel is on. Now just lift the foot straight up off of the table. So keep the knee bent and just flex at the hip. Okay, there you go. Just lift the foot up 6 inches or so and back down. Nice and slow. You can rotate one knee out to the side, so slowly lower out and back in. We talked about kind of a butterfly exercise for range of motion with the hip. So keep the feet on the table. on, drop the right knee slowly out to the side, bring it back. Drop the left knee slowly out to the side, bring it back. So again, these are really, really, really low level, but it takes a lot to get the muscles firing, to get them to stay on, and then to be able to add movement. You can add upper extremity movement, all the while the pelvis shouldn't be moving, the low back shouldn't be moving, and the muscles should be engaged. There's a whole series of exercises different therapists have put together to progressively get harder. But just starting with these very, very gentle, basic exercises is really where we have to start. You can also add some biofeedback. So a couple of types of biofeedback. We've got a stabilizer, or we've got a blood pressure cuff that you can slide underneath the low back. So if you want to go ahead and sit up for a moment, I can show you the stabilizer. Lie on the line. So you can use a regular blood pressure cuff. Most people don't have those, but this is the stabilizer. It's just a little ladder that has a pressure gauge on it. No, usually I leave it flat or underneath the low back just because it's a larger surface. So he's going to lie.
Oh, you're going to lie down.
So if you want someone to stabilize, so think about the word stabilize. It's stable. You want somebody to stay still, muscles contracted at the trunk while they move other things. So you can get the stabilizer underneath the low back, make sure they get into a nice neutral position, pump it up to where they feel the pressure under their back. And now the goal would be you need to hold this at the same pressure. So whether it's 20 or 25, whatever the dial is on, say hold it right at that spot. You do your Kegel, there shouldn't be any movement. You should be able to hold that Kegel, slide the leg out and back. There should be no movement in the pin. Now what's going to happen as soon as the muscles are on and you start extending the leg, we're going to go into an anterior pelvic tilt. What's going to happen on the pressure on the dial that's underneath his back?
Very nice, dropping like a rock.
It's going to drop because your back is going to arch. You're going to get into a lordosis as you take the leg away. And then as you bring it back to you, then your pressure gauge, there's going to be more pressure, so then it's going to go back up. So the goal, I will check these out to patients, and their goal is just to spend 10 repetitions 2 or 3 times a day. Lie on the floor where it's flat, throw the stabilizer underneath you, do your Kegels. You should be able to Kegel without the stabilizer moving. Now add a little bit of movement. And this can be very frustrating because you just think about starting to move and that pin starts to move. But it gives a patient biofeedback because can you tell if your pelvis is moving? We can typically because we're trained to actually feel what's going on there. But most of your patients who have no clue what's underneath their skin, they don't know what's happening. And they'll say, oh yeah, I'm doing great. Look, I'm doing fantastic. Yep, my Kegel's on. Yep, sure is. I go, great. Well, let's stop moving through here. Let's put the stabilizer underneath you. And I want to see that pin stay still. And I'll give them a range. Don't let it move more than 20 millimeters of mercury. That's your goal for right now. Don't let it move more than 20. All right, can you master that? All right, now let's not move more than 10. Now try to keep it still. And of course, it can get pretty frustrating. And again, it's a long process just to try to work on controlling this. But you will see a huge difference, especially with women's health and incontinence and low back pain, that you're able to pressurize the torso much, much better. It's pretty exciting when a lady comes in and she's elated that she was able to go to the movies and not have an accident, when she laughed or coughed or sneezed or something, because that's a social issue. My dear grandmother that I love so much came to visit me here, and she loves the Ducks and wanted to go to the game, but the thought of 4 hours, and her knees are going bad, the thought of 4 hours in the stands with her knees not able to get her up and down the stairs to get her to the bathroom once a quarter, she ended up not going to the game. So this is a social issue that you can really change lives just by giving somebody a little bit more independence, a little more stability through their pelvic floor. So it's pretty exciting. It's one of those odd goals to see muscles. And so you can do this biofeedback. It's very, very personal, and everyone gets their own probes. There's no reusing or anything, no disinfecting and reusing. But you're in a private room, and you're training your muscles. You're actually engaging muscles, looking at this visual representation to see if you are contracting, or if someone has tight muscles, trying to relax. And it's a long and intensive process, and you did some women's health, if you want to share a little bit about that before we move on.
Sure. So when I was in PT school,